morning, everyone. Thank you for joining For the Health 1 year later, a conversation on race and food allergy. My name is Karen Palmer, and I am the owner and founder of Karen Palmer Coaching, and also a food allergy parent and advocate. We've come together today through the tireless, continuing efforts of Emily Brown, the founder and CEO of Food Equality Initiative, and her amazing staff. FEI is the nation's leading organization working to increase access to allergy-friendly and gluten-free foods, for the individuals who need them the most. On everybody's behalf, I'd like to thank them for making today's conversation possible. Over the next hour, we're going to discuss some notable developments at the intersection of race and food allergy over the last year with the folks who are responsible for making them happen, all in the midst of a national reckoning on race and policing, and as well as the continuing global pandemic. So without further ado, I'd like to introduce Dr. Lakiea Wright-Bello, a board-certified allergist and the U.S. Medical Director of Immunodiagnostics and Clinical Affairs at ThermoFisher Scientific; Javier Evelyn, the founder and CEO of Alerje; Hawthorne-Silvera, CEO of the Elijah-Alavi Foundation; Dina Hawthorne-Silvera, Vice President of the Elijah-Alavi Foundation; and of course, Emily Brown, the founder and CEO of Food Equality Initiative. Thank you all so much for being here. So we all came together 1 year ago. It doesn't seem like a year, and then it also seems like 10 years at the same time. We wanted to talk about making positive and lasting change for Black Americans who face multiple obstacles in accessing quality healthcare, particularly when it comes to dealing with food allergy. Healthcare challenges affect every sector of Black America, and that includes people of every age, every income level, every type of educational background. The emergence of COVID-19 made the issue of racial inequality in healthcare starkly plain, with disproportionately high numbers of illnesses and deaths in Black communities across the United States. Then the murder of George Floyd focused the attention of the nation and the world on the public health crisis of police brutality, which most often targets Black men and women. Against this backdrop 1 year ago, Emily Brown shared her personal experiences with the challenges of being a Black food allergy advocate in an open letter to the food allergy community. And so, Emily, I'd like to start our conversation with you today by asking, what has this year been like for you?
So I think I can speak, I speak for myself, but I know that voice represents so many others in that the last year has been, one of the most challenging years of my life. As a mother, as a wife, as a caregiver, and as an advocate, just trying to find the balance between it all, while also really working very hard to build bridges and build connections so that we can have a better, stronger community. The work that we do at Food Equality Initiative is absolutely critical for families that are, really looking to meet their basic standard of care, to have access to the foods they need to manage their health. And we know that the economic fallout of the pandemic has disproportionately impacted low-income wage earners. And we know historically, because of structural racism, that many Black and Brown families were impacted by that economic downturn. Now, I do want to make it very clear that Black does not equal low income. It does not equal, poverty or food insecurity. But because of the history of structural racism, we have these disparities, and we know that Black and Brown families are disproportionately impacted simply because of the structural racism and oppression that has long held our country. And so, we have seen just significant increase in need over the last year. Food Equality Initiative has sustained a 300% increase in utilization of services. And so, it's significant. I thank my team who really stepped up and met the challenge. And I also want to acknowledge that we could not have met that challenge without partnerships and allies from the community. And so over the last year, we have had an increase in partnerships and allyships from the community, which has allowed us to sustain and meet that challenge. Also, something that I recognized over the last year is, we've really become more comfortable around having these types of conversations. I actually went back and looked at my calendar and totaled up the number of times that I was able to provide or give a presentation around racial and economic disparities in food allergy. And in 2020, I gave 16 presentations from April to December on economic and racial disparities within food allergy. And, one that's attributed to the virtual environment being much more accessible and making these conversations really more accessible and widening our community. Because I probably could not have done that in person. I would not have physically been able to do that. But just the willingness of organizations to have that conversation increased. And so I'm grateful for that we're able to raise awareness and have more consciousness. I always think there's opportunity for us to do more, but I will acknowledge that I've seen just a significant increase in willingness to have the conversation, to be open to listening and understanding some of the challenges that Black and Brown families are dealing with in our community. And so for that, I'm grateful for that progress.
If I can interject for a second, number one, thank you for pointing out that is really difficult as the last year has been, that there are some benefits that, the creativity in the response to the pandemic has produced that have pushed us all forward. And certainly that ability to take our conversations from being local conversations or conversations that are dictated by who can afford to get on a train or a plane, that actually changes the playing field for interaction and for collaboration. So thank you for bringing that up. I also wanted to find out, in terms of FEI and the work that you all have been doing, what are the big wins for you this year?
So I'd say the big win is, we made a significant change in our distribution. So prior to the pandemic, we primarily delivered services through what we called a pantry within a pantry model. So we partnered with pantries who did the work well. We negotiated for a certain amount of space through an MOU process. We stocked those shelves, trained their partners, their staff and volunteers, and then we maintained relationship with providers who are referring clients to us, and then also maintain relationships with brands who were donating or we were procuring at a reduced rate. We knew that was not the ideal model, and we're working really hard prior to COVID to change that distribution model to something that would be more client or patient centered. And so we did several tests, and we knew that direct to door was the most effective distribution model. And so COVID really gave us that opportunity to jump in, and we had to make a change. Everybody had to adapt during COVID, and so we took that opportunity to jump head first and say we're going to do direct to door delivery. So all of our clients never lost their ability to choose. There was always dignity of choice, so they could select the foods that they want and need and then have them delivered direct to their door. We also invested in an online marketplace, which really, I feel, has changed the game for our families, because again, it gives them that dignity of choice to select exactly what they need and want within the parameters of their prescribed diet, but then also have, the ability to select within their cultural diet the foods that they want and need, and just the ease of having it delivered within 2 days, just the dignity, there's no stress. It's just, everything in one place. It just really makes it level up for our clients, that service that we're able to provide. So that really is a big win, a big game changer for us. It also makes our work instantly scalable. So now we're no longer really tied to serving patients in the Kansas City metro area, we are able to then deliver services across the entire continuous 48 states. And so that has really been a game changer. We've also really made some strong research partnerships in 2020 and 2021. And so we've published a few papers over the last 12 months about our work, and are really, really pushing and really working to build that pipeline so that, this work will be covered and sustained one day. That is the vision. And we believe that, through our partnerships and through our work, that we will get there.
Well, that's extraordinary. And I think I can speak for everybody in saying our hats are off to you during this period that was incredibly taxing and trying, that it did indeed, as we talked about, push you to higher levels of innovation and put you in a place where you are serving a far greater constituency than you probably would have imagined possible 2 years ago. So definitely, I want to put a pin in this and come back around to it, because that will apply to some of the things that I'm hoping we can talk about during our group conversation later in the hour. I want to move Dr. Wright to you and to ask you, in your capacity as an allergist and a medical director, what's been happening with you over the last year regarding race and food allergy?
Yes, so I think I share Emily's sentiment in saying that, it's been a challenging year, and for me, an emotional year, to sort of talk about these health disparities, and particularly as it pertains to food allergy and other allergic diseases. And I think out of it, there's really been a heightened sense of awareness of racial health inequities. And we always have had these health disparities, but as we mentioned before, they come to the forefront due to the pandemic and the murder of unarmed Black people by police. And I think, it's different stages, and for me, it was really sort of this acknowledgement, stage, and then really organizations taking action to move to more sustainable change. And I think that the acknowledgement that racism as a public health issue and really a public health emergency, as Emily had mentioned about structural racism really being at the core. And as it pertains to food allergy, we tend to talk about asthma disparities, which are important, but also highlighting the other disparities in the space, including food allergy disparities, and looking at how that structural racism and structures and institutions are contributing to these disparities. So if you look at things like access and education, when we talk about access, we're talking about access to high quality primary care, where there's an emphasis on guideline-based care, stressing the early introduction of food to try to help to prevent food allergy, but then also access to high quality food for introduction, and doing the education around that. Not everyone, especially communities of color, including Black and Latino children, have access, and their parents have access in that way. And then when children do, or even adults have reactions, food allergy reactions, they're less likely to see an allergist and less likely to be diagnosed, and even they're less likely to be tested, even if suspected food allergies at play. And so really trying to tackle these issues, and as Emily mentioned, having the research, and I would say one step in the right direction is trying to design interventional studies. And we really know that would help, because we want to be able to close the gaps. So we want to document the problem, but we want to know what is the most effective way to close that gap. And I think that has come to the forefront about how we can take action and how that action can be sustainable, how we can make the action sustainable. So I think that has really been a really important area in which we've made some progress this year. And we still have more progress, but we still have a ways to go, but we have made progress.
Thank you for sharing that. And you've touched on a number of points. Again, once we get to group conversation, I'm taking notes. Definitely ready to dig in. Javier, I'm going to come to you next. I hear you might have some very positive news to share.
Yeah, 2020, obviously, I echo everything that's been said so far. And obviously, I just love the work that's been done by everybody on this panel. So super excited to be here. We just most recently announced some work we've been working on for a while, for lack of a better phrase. We got a patent for our flagship auto injector to really help out and just really start to democratize who should have access and how, right? I have food allergies and I'm representative of the fastest growing population in the country. That's why we're here as it relates to all things food allergy. So obviously super enthused about that, but it took a lot of, I would say not just, it ain't just me that was in the lab doing it. I have an incredible team, obviously. And when you talk about allies, you're talking about folks that do the work. There's been so many people that have shown a lot of grace to us over the years to allow us to continue to get the work done. Whether it's, hey, from to be transparent from a startup perspective, the legal side of what we do is incredibly, it's an investment, it's not a cost, right? So making sure you work with folks that understand that, they understand your early stage, and for a fact when you get that bill, this is a fraction of what it should be. And not that everybody, I'm not going to call out any firms because I'm not promising any discounts across the country, but I will say that that was huge for us, right? And obviously the entire food allergy community really rallying around us, everybody on this call, to ensure that we're thinking about this right. But the part, when I reflect what we came back from, top of the year, getting to a point where you run to the end of the road once you thought it is, and we had to do a staff reduction for a bit. That took about a month for us to bounce back from. And it's because of organizations that before even things happened to, the lynching of George Floyd, right? They were about that, right? So we're starting to kind of see who's a hashtag or a tile poster versus those that interact. And I think we work with a lot of those folks on this call. So we're starting to see that. But when I zoom out, I'm a tech innovator, obviously in the food allergy space. It was a very unfortunate study or some research stating that about $150 billion that was invested into Black or just founders in general in all of last year, 0.0067%. 1 billion. 1 billion is a lot of money, don't get me wrong. But when you think about the massive difference in terms of who's getting funded, it's not right. When you think about where this country's going, by the year 2040, 2050, Black and brown people will be the majority of this country. So the programs that we established, the innovations that we're working on, literally is a glimpse into the future if we just kind of think about it and reframe that correctly. So I would love to see as we continue to hit milestones. We got grants coming soon. We're going to make an announcement around that. I wanted to say it today, but Lord knows I can't because we're not going to be able to get it right. But even outside of that, we're really starting to see, more biz dev opportunities, right? If we get to a point where Emily's innovation or our innovation, anybody in this call's innovation, we don't just get that first date, but that second and third date, and we're now doing something a bit more serious with a partner to reflect the enthusiasm that's been shown to our company and other companies that look like us. I think that's when we're starting to really move the needle forward. Tiffany Ashley Bell, I think that's her name. She's on Twitter. She's great, not in the food allergy space, but she had this campaign, Make the Hire, Send the Wire. And I think that's really what it's all about. We're starting to see a lot of firms in our space, by the way, that are starting to have a lot more big hires that look like us as well. And I think we got to give kudos to those folks as well. Obviously, the folks over at FACT to create different programs and the 7% initiative that Emily's leading to ensure that we can really get as many people out. So it's a really good moment, not just for, obviously, in light of all that happened last year. I'm not going to sit here and say it was rosy. We lost a lot of our soldiers, our good folks. But what we intend to do is make sure we live up to the legacy that we were trying to build in the first place, getting our innovation out, getting the investments. And I think more intentionality and more accountability around, am I investing in this space? One, or am I having meetings with folks that don't look like me, diversity supplier programs? I think that's going to be a huge opportunity as our industry starts to evolve, continues to evolve, because it ain't where it was 10 years ago. We're in a very special space. When you think about OIT, different things around different aspects of the industry and how we can play a role to make that happen. Lastly, I will say that we've been truly supported by all the doctors in our community. Like I put an ask out on Twitter or social media. Shout out to Dr. Wright. I sent her random messages. She's connecting us with folks all the time as well too. So this is a good moment, and I know we're looking out for each other. We have some amazing allies and advocates. I think the other folks that are supported from afar need to kind of start not only looking at our efforts, but the efforts of our allies. There's some really dope allies that are out here really rolling up their sleeves doing work. And I want to make sure that I acknowledge that as well too, because this is not, again, as mentioned, an only Black problem. socioeconomically, when we think about the pandemic, lots of folks are impacted beyond Black and brown folks. When we think about accessibility of medication, what M's working on, what everybody's doing, Thomas and Dina getting laws sent out to make sure things get better. That's what it's all about. So I'm just enthused and energized by the momentum of last year, with the understanding and humbleness that we still got a long way to go, but it's an exciting point in time to be in our space at the moment.
Thank you so much. And definitely, something to touch on later is the importance of, community and who makes up community and, how that can be built and then sustained. So definitely going to come around to that. Thank you so much. Thomas, I know this has also been a very productive year for you, certainly for you and Dina, and I would love to hear more about that.
Yeah, no, absolutely. Again, Emily, Karen, everyone on this call, it's so great to see you all. I guess, to kind of like recap from last year to now, last year it was, we kind of had to put a lot of our food allergy training on hold due to the pandemic. So we had to figure out a way to pivot and get more attention out there. So we created the Elijah Echo Ambassador Program, where we geared it towards children, but also parents to get involved as well. And create the encouragement and empowerment for young children just to have that voice, because I always go back to my son, he was 3, who didn't have a voice. And I want parents to actually educate their young children from infant up into an age that they can manage and be more empowered on their food allergies. So with the ambassador program, it allowed us to pivot and actually send out to a very large group of kids across the nation, which was exciting, but it was challenging at the same time. And, we've worked with a lot of organizations to kind of like help build this ambassador box. It's almost like a subscription box. We have products and things that we put in from different organizations or food companies and so on. And, the children were excited to receive it, and that was like our baby. We, it was sad because we couldn't get into the schools to do the training that we wanted. And, we had conversations with our partners on building an online platform. And, coming in this new year, we actually will be launching it as of August 1st, nationwide. That's exciting. We built that, getting Illinois legislation passed this year. The governor is going to be signing that legislation. I know, because someone personally that knows him told him that he will be signing the bill. And, just having also Pennsylvania on the docket now, which we submitted Elijah's Law to, and talking to other legislators and states about implementing the Elijah's Law. And, last year we had a lot of donorship there, but they also pulled away as well due to the pandemic. And it hurt me in a sense, because a lot of the story was, well, because of the pandemic, you're not doing anything. So, the donation, it's not relevant in a sense. So it was like, I just kind of like just stood quiet and just allowed it to be. But, it's unfortunate that had to happen. But my wife and I said, we have a small budget, a small team, but we're doing very big things and very impactful things. And with everyone here that we've worked with hand in hand, from Lakiea to Javier to Emily, Karen, everyone supporting our initiative and pushing us forward, we continue to have that drive no matter what the circumstances are. And we want to make sure that we keep doing that. Whether we receive awards or accolades or notoriety, it's not about that for us. It's providing that care, that understanding, and the education, the awareness, and just having that, and making sure we don't lose sight of why we started this foundation, in terms of focusing in the underserved communities that are faced with health disparities, and working with universities and other organizations, building toolkits and formats so we can go into these communities, grassrooted, not just through an email or a flyer or a webinar. We want to physically be in a community, working with them hand in hand and providing this information, because health promotions in our communities are scarce. There is none. With our son, especially when they were younger, we had to travel to the Upper West Side to receive food allergy treatment and so on. It should
Midtown.
Yeah. So, and the wait list for that as well. So we want to build a program where we can have in these communities access where their health insurance can cover it and not have to wait 6 months to a year to have that type of access to care, and provide the education to the parents, whether in their homes or in their schools or their community centers. We want to be that gold standard, and be that voice for our community. It's more than just providing the awareness. We physically have to be in there on the ground doing the work.
We also want our community to trust our faces and us. We love the work that we do, but the reality is when we go to workshops, when we go to different organizations and programs, when things were open, it's a real challenge at times because we need faces like ours to be in our community, to trust us, because they don't see us in the community talking about these types of things. A lot of the times it's really challenging to get them to listen to us and trust what we have to say, because they don't see us in those spaces as often. Outside of being a doctor or a nurse, a foundation like us coming into a community, they're like, who are you? And why should we listen to you? And why should we care about your resources? And so that's why what we do, despite the pandemic, keeping our voices in the community. And, just like Javier was saying, it affects everyone that's in those spaces. And we want to make sure that we are providing the information, no matter the circumstances that are happening. And it's, when it comes to allyship, we do appreciate some of the ones who remained, in communication with us to provide certain resources that we're able to provide to the community that they would not have had we not had that support. So that's a big plus in that space.
Dina, let me ask, what are you proudest of having achieved over this year when things were so difficult? You all have not stopped working, and clearly by virtue of the things that we've heard announced, the legislative victories, the announcement of the program that you all are doing for the online curriculum, in combination with Team Belay. What are you proudest of having accomplished during this most difficult of times?
Honestly, it's the Elijah's Echo Ambassadors program. I love children. Don't get me emotional, y'all. But I love children. I love that we get to focus on the little ones. It is a challenge. I know that a lot of people don't want to do it because it's a challenge. And so for us to be able to create an ambassadors program during a time where people were just finicky about even getting packages or like going to their door and ensuring people that it's safe, but seeing those smiles on those children's faces, hearing stories back from their parents, particularly about how it made their children feel. One of my really good friends that I haven't spoken to in a long time, I sent her daughter a package, and it just opened up a conversation that I never knew about her daughter or about the challenges that they were facing. And her daughter felt so empowered. She couldn't wait to share with her other peers that did not have food allergies. And it brought so much joy to my heart. Like, at least we can keep the conversation going amongst these children that are also going through a really tough time. And then also, keeping parents abreast to what's going on with new information that they didn't even have, but also keeping it lighthearted too for them, because it is a very intense conversation sometimes to have. And so the best thing about this program is it can lighten the mood a little bit while still educating.
No, it's thank you so much for giving us more detail on what the program represents, because the theme of community, again, comes up over and over again. And it's so important to remember that for children who are dealing with, a new food allergy, for example, the feeling is always, oh my gosh, this is this thing that's happened to me and I'm out here all alone. And so the power of being connected to a community of kids like them, is just life transforming. And so, hats off to both of you for making the experience of community at the child-centered level available to so many kids during this year. It's really incredible.
My kids received boxes, and it just brought them so much joy. And the fact that all of the ambassadors, the little characters that represent the ambassadors, are very diverse, and that they could see characters that look like themselves. So kudos to you guys. Just fabulous job.
Thank you.
Yeah.
If I can just, sorry, Karen. What we've learned, one project that we've been working on with Indiana University is we've been doing research on Black and Hispanic children going into the emergency room with anaphylaxis or asthma and seeing the type of care that is being provided to them. And so so far it's going to be probably about a year-long project because we're still, accessing the surveys, speaking with the parents of these children. And with one of the research that I've received back, that they all almost share the same sentiment, is that there is no other information provided to them other than you go speak to your primary care physician. There wasn't information given to them about avoidance of these are the allergic reactions. You must, this is an epinephrine auto-injector that you need to get. So a lot of it is in the emergency room. It's like, these are the things they should provide the type of information to the community. So when they do go see their primary care physician, that they have that type of information, that they can provide it to them. Like, hey, this is what I was told. My child, this is his first reaction, or this is his second reaction. I didn't know much about food allergies. And especially when it comes to young children and parents who are unfamiliar, especially in the Hispanic and Latino community, in the Black and Latino community, this is quite alarming. And, and I think when we look at, we've always provided data. Data is key to everything. So we can know that this is the research that's been done. When you're actually physically going into the communities and talking to the community and getting this response, then you're like, wow, we may be missing something here.
And this is true because when I first had my experience with my son, that's exactly what happened. And thank God my husband, he's abreast of this type of information, but that's exactly what happens. They don't tell you they just said, oh, it looks like they had a reaction to something, so go to your primary care doctor. But there's nothing more. And even when they give you the printout, for me, I'm educated, I can understand some of the, the medical jargon, but I do think about the community where if this is your first time with your child and you're not really walked through or given the basic of information when you're going to your primary care doctor, it is problematic because you don't even know what to ask, really. You're kind of like poking around. So that's kind of like, thank you for bringing that up. That's another great thing that we did do during the pandemic, getting this research done.
And it's important. So when we do go into the communities, we can say, hey, when you do go to the emergency room in the event of an emergency from an asthma exacerbation or an anaphylactic reaction or allergic reaction, this is the type of information you should be asking the questions to the emergency room doctor, and make sure they provide you with information that you can provide to your primary care physician other than just a discharge paper.
As usual, you all jump right into the heart of the matter, because where we're at now is that, I wanted to open up the floor to group conversation to be able to talk about, the fact that, you've all had an incredible year in terms of the advances you've made for your own organizations, but there are plenty of challenges that remain. Certainly the challenge of sharing information among newly affected members of the community is a big one, and something that we've actually referred to in previous discussions with folks like Dr. Ruchi Gupta, talking about her patients in the research projects that I know Emily is aware of because they collaborate. But I do want to, first of all, thank you all for sharing the incredible progress you've made in all of your individual areas of accomplishment in the face of what might just qualify as the most difficult year we've endured collectively as a generation. And I think that's something that needs to be recognized. But although you shared these incredibly positive developments that do represent real movement, just what you've expressed here represents the ongoing nature of, the struggle, frankly, that folks in the race and food allergy space are dealing with. And so I would love to talk a little bit more about how you think we might best address these challenges and, how we continue to build and sustain community to help in doing that. And so these questions are directed to all of you. Please jump in and volunteer whatever you think is necessary to move things forward. Thinking very specifically about the aftermath of the death of George Floyd, there was a lot of public discussion about white Americans exploring how they could be more effective allies in the fight against racism. And each of you has spoken about the importance of cultivating allies in that community in order to be able to accomplish the goals that are necessary to improve outcomes for Black and brown folks with food allergy. So what has the last year revealed to you about the nature of allyship where race and food allergy are concerned?
We've, just like everyone on this panel, we have seen allies step up, and we've had allies, some allies we've had all along. They were there from the beginning. They were supportive. They've been supportive, and they're going to continue to be supportive. I think what it means to be a good ally is, showing up, and in some ways sharing power, sharing space, and, passing the mic, letting or amplifying, providing a platform, amplifying the messages. And also, Javier said it really well, where the hires and the wires, we know that this good work, it does take time, and it comes at a cost. And, all too often, the work that, Black-led organizations and innovators do is just exponential, and their value is exponential compared to the financial support that they receive in order to do the work. And I think part of that comes from, Black and brown people, because of structural racism and the unique challenges that they've faced, that we've faced as a people, have just been very resourceful, very resilient, and just, have this ability to create out of, almost nothing. But when you do that, and I read one of Stacey Abrams' books, and she talked about how, when you're almost taught to overperform, and that is like your base is is overperforming, then it's like that exceptional behavior almost becomes devalued, because you're exceptional all the time, right? And I'd say that for, everybody on this call is doing exceptional work, is working at a very high level with limited resources. And so I think, as we think about allyship and sustained allyship, and what is really needed to move forward, is just that continuous support, and continued shared resources, and I'd say reallocation of resources to really grow the good work that's already been done, because the work is being done. And like Thomas said, even when things change financially, we go back to the table and we find a way to make it happen anyway. And I'd say that for everybody on this call. But, we need to, I would make a call to allies to say that, we don't want to function like this. We really don't. We need your support so that we can continue and it can be sustained. Because one of the challenges with this overperforming all the time, I think about our sister Fannie Lou Hamer, who famously said, "I'm sick and tired of being sick and tired," right? And I can only imagine just the wonderful things that Sister Fannie Lou Hamer could have done if she had lived longer. And she didn't live longer because she had poor health, and just the burden that can also come with having to be the one that's overperforming and constantly pulling it together.
I was going to say, you have my heart with everything you said, number one, especially when you talk about the reallocation of dollars. I think it goes without being said, when you talk about from a VC level all the way to the nonprofit side, it's not being distributed properly. So hire more Black folks to write checks. It's as simple as that. They may seem like a very, not archaic, it seems like a very simple step, but it's also going to allow access to more deal flow. You're going to have access to more up and coming, I would say, organizations. And also, if I'm looking at y'all business, and I know I'm going to add not extra zero in college just because, but I know what it takes as somebody that sat on the seat. And I get that conversation that happens when we talk to investors and things of that nature. Double clicking on the allyship, it can be done just by rolling the sleeves up, right? Thomas and Dina mentioned the work that they're doing with University of Indiana, working with different organizations. We developed a medical advisory board, and I got to thank Dr. Wright again for some great recommendations on that as well too, right? That's another side of it, right? Okay, let's get together and work on this innovation together, because I don't only believe in what y'all are doing, I believe in you as a founder. That means a lot. That means an incredible lot. It means a ton of support when you get that from folks that lead in this space, right? So we get all this street credibility, and to your point, the darker you are, the harder you work. That's the way I grew up hearing about it. And it would be great to kind of see that ROI kind of come on the other side, where we can take, that level that you talked about, Emily, in terms of working at that high level and being properly, I would say, resourced to do the work is really going to it's going to create a little bit of a renaissance, not only in the food allergy space, but just in general. I think healthcare, I'm biased, we're all biased a little bit in healthcare, but I truly believe that when you have a fifth of the GDP being spent wildly, and it's probably even higher because of COVID, obviously everything took a second back seat, but as the dust kind of settles, we kind of got a better sense through telemedicine to know what's going on these days. Let's double down on those that have done it with little to nothing. And I'm a guy that grew up, my mom would put water in the eggs and tell me it's going to make it fluffier, right? That's called survival. We've done that, but we need more nutrients. We need more protein in that to really get stronger and grow the level we need to.
Javier and Emily, you've both talked about the need for greater investment of resources and energy, because, the point of having to perform at an artificially high level in terms of the energy you devote is huge, in the sense of also depleting your own creativity and your ability to be able to push your own projects forward for the benefit of all. And so I'd like to bring Dr. Wright in here and ask, in terms of this concept of allyship, what would that look like from your perspective, and what would that allow you to do in a different way now that you haven't been able to do over the last couple of years?
Yes, I thank you, Karen, for asking about that. I think that being a healthcare provider, being an allergist, I tend to focus on the health disparities, but I acknowledge the role of structural racism. My colleagues and I recently published a paper back in February about the United States reckoning with racism during the pandemic. What can we do as allergists, immunologists? But actually, it's broadly sort of applicable, and we have to acknowledge that there are sort of different stages. So we have some colleagues that are sort of in the denial zone. They say, oh, well, we don't need change. I'm not a racist. Racism doesn't exist. And then complicit zone is like, well, what can I do? What can I really do about it? I'm not personally racist. And then you have that active learning zone where you're partnering with organizations. You may be volunteering not to help, try to help save people, but you really want to understand what they're going through, and you want to affect change on that individual level. And then it comes to the point that I wanted to make about the transformative zone, where you're taking more collective action and acknowledging that we have these health disparities, but we have to dismantle the structural racism that is creating this problem. And as Javier and Emily mentioned, it's about health, but it's also about economics, because we want to make that investment in the community, different organizations within the community. And then also education, we even from, pre-K through college, so that we can, elevate everyone to dismantle that inequity. And that really gets at the policy change that is needed, which is multifactorial. And I think that, for myself as a physician, I have to play a role in that. And then all of us in our different respective areas have to come together collectively to affect this change. And it really is about the policy change in those different facets of life: health, economics, educational, and, simple things like earning a living wage and then making investment in different organizations. These are all connected. And I think that's where we really need to go into that transformative zone and work together.
Yeah.
Something you've also spoken about, I heard you speaking about it in the past, is in terms of the research itself, changes that need to be made. And it would be wonderful if you would speak more to that, how you can really, help to reduce and hopefully at some point remove the disparities in terms of outcomes for Black and Brown families.
Yes. And so we tend to document the problem, which is great. That's the first step. These disparities exist, for example, and, racial and ethnic disparities in food allergy. And as Thomas mentioned, there are things like, not being told what diagnosis you have, what foods should be avoided, and then not being given a prescription for an epinephrine auto-injector, or perhaps not being told why it's so important and when to use it. And so this educational aspect of it, and sort of this the access to high quality care aspect of it needs to be addressed. So we want to not only document the problem, but we want to design those interventional studies. So we want to come up with protocols so that we are not missing the Black and brown children and adults that need to have the proper information, the proper diagnosis. And we want to make sure they have access not only to their primary, a primary care who can help give them the proper diagnosis, but then also with the follow-up, have access to allergists, have access to testing, skin testing, the blood testing, so that they can be properly diagnosed. And then when we talk about research studies, we want to, and we talk about treatment like, OIT, we want to make sure that we're including different populations, including Black and brown people, because we want to make sure that those results are generalizable to the population.
Mm-hmm. So what specifically do you need from allies in order to make these specific steps happen?
So I think that what we need from allies is further acknowledgement of sort of the problem and how we have to have short-term goals and sort of long-term goals. And I think we get stuck at that sort of documenting the problem. But I think that as a scientific medical community, we have to have, like a higher standard about, we're going to fund this research. First of all, the funding needs to be a priority. And then when we do fund the research, we need to have that interventional step as sort of as a requirement, because that's going to help us, move the field. And then we also need to have improved access to specialty care. We mentioned things like telemedicine, which I think is really important. But then we also have to acknowledge the digital divide. So how do we, address that? Perhaps it's a combination of video and telephone, and then having internet services, covered, or cellular phone services covered as part of your healthcare. And so I think that, working as putting in individual efforts and, donating our time and money to organizations, but then also working collectively to tackle these big, issues with allies, but having our voice be heard so that we are helping to set the priority, I think is a huge, important part of affecting change.
That's so critical. And thank you for expounding on that in so much detail. I mean, that leads us to, a point that Thomas and Dina are intimately familiar with, the importance of legislation in the process of being able to ensure better outcomes for, Black and brown families. And I would love to ask you both about, your experience with Elijah's Law and what you have learned over the last couple of years in terms of the role that allies can play in, helping to make this legislation real.
What really stood out when Javier said this, and I was just like jumping in my skin, was the fact that you have to believe in us, those of us who are doing what we're doing, and not just what we do. And when he said that, I'm like, that's the issue right there. Because if I just throw dollars at what you do and I walk away, I don't really have a deep connection to what it is that you are actually doing. Mm-hmm. It could be just a write-off for what I'm doing or what I need for in this quarter. So we start to change that process. That's really important. Dr. Wright said something about acknowledgement, acknowledging the internal biases, acknowledging the actual issues that is happening. And all of that, to what Emily Brown was saying prior to access, creating partnerships and brand deals and such, all of that comes down to policymaking. Because the reality is in the legislation is people are not going to do what they don't think they have to.
Absolutely.
So we all go back to regulations. And so processing and getting into legislation, getting into policy making, doing all of these things. Allyship, to me, the number one is acknowledging that the issue actually exists, not individualizing your personal preferences and issues with it, but acknowledging as a whole that it actually exists. Because when you remove, well, I am not, and I don't, you're actually saying that it doesn't exist. And the more we stay in that mental process, we can't move forward with allies, because you come to the table thinking that you're not part of the problem. We're not saying directly you are racist, but we're saying the structural divide is. And if you acknowledge that part, then you can support the legislations and the policies that's being passed down instead of taking it personally, understanding that that is the issue and the structures that we are talking about that needs to be addressed, which is why these policies are necessary. Elijah's Law would not be necessary if there were things in place. And we've come to realize, a lot of people take it personally. We as a community don't get to personalize our experience, because you can throw a stone and everybody has a similar story. Our allies, a lot of the times, they take this approach of, I'm such a great person, I am not the latter, but that's not what we're talking about. If you're going to support us, you need to acknowledge the fact that the conversation needs to be had, and not just with us, but in your communities. So I wrote down, the internal biases needs to be recognized. And also people need to start getting really uncomfortable when learning about these topics. And also when we are addressing them, if you do feel a little uncomfortable, listen to us. And maybe you'll learn a little bit more so that you can take this back to your constituents and say, you know what, I was not abreast to all of this. It's not personal. There is an issue here that lies ahead, and we need to do something about that. That goes into how funding is then given, because then you would care about us, the individuals who's doing all of this work. And I believe—
So, Dina, I'm going to stop and hop in for a second, because you are going to a place that is super important in the context of where we are in this society right now, because the whole idea of people needing to essentially put, as you're putting, skin in the game, to develop a sense of urgency around these issues where one did not exist before. George Floyd's death was a watershed event that raised a lot of consciousness in areas there perhaps it had not existed before. But we all know compassion fatigue is real. It's a year later. People who have not had the opportunity to have the life experiences that all of you around, the virtual table have had, are realizing how much work it takes to undo the effects of structural racism and to unpack everything that supports it. So, number one, what has to happen in order to sustain that level of interest to keep the community that, rose up publicly? How do you create that sense of urgency to move forward? I mean, people do this kind of activism around breast cancer, around juvenile diabetes, heart disease. People who are not personally affected by those issues donate money, do walks, all that kind of stuff. It hasn't happened yet on that level for food allergy.
Well,
what has to happen?
Well, I will say this, and my husband can jump in. I will say this: they support community outreach. That's what the walks are. That's how they support, and they believe in those people. They don't just believe in the breast cancer, they believe in the people behind it. So that's why they support the community outreach. We need the support in the community and the programming that we're providing, the workshops that we're doing. Javier just got a patent. Provide the support that he needs in that space. Emily has a pantry. When you support the community outreach consistently, because every year we have these walks. So every year we should be able to see all the time consistently the support in our community outreach, not when there's these massive, trends that are, because, we tend to trend ourselves when they throw us out into the media and we have these conversations and then it goes away. The black squares are gone. Right? The hashtags are gone. Yeah. But there's that consistent support of community outreach, the support for the programming, the funding, the work that we're doing doesn't match the funding that we're getting. And we all can sit here, and I will very candidly say, we know of research that is, not even close to the work that has been done in the communities like ours that has been funding, so much more, right? And it's not like we're nickel and diming, but we're saying we have the voice in our community, and that you need to trust that we know what we're talking about and what we're doing collectively as well, which will allow them to support the community outreach consistently. And to that point, I'll pass it off to him.
It's bigger what she said. It's also to support what we're doing consistently and building that allyship. Like Emily has stated, sustainable allyship. And making sure they're on the ground doing the work with you, getting their hands dirty, and being that ally. It's different when an ally wants to be an opportunist and work on the trend of the Black Lives Matter movement, that's not sustainable. That's to make yourself look, hey, look what we're doing. We don't want that. We want that sustainability and that allyship, that we know that you're going to support us and know what we're doing and be about it, not just, talking about it. It's more than funding, because we're all putting in that hard work, and we can do it with the very smallest scale of a budget. We all can say that we've done it. We've sat and we bust our butts doing it. There's so much more to that allyship than just being on that opportunist trend or whatever. Like, there's a lot of things going on, and this, you don't see, like you said, you don't see the black squares. You don't hear much talk about George Floyd. You don't see it. Only when the dates are happening. Yes, it's a great day that we have on Juneteenth to be recognized, but what is being done behind that signed legislation to make this a national holiday? There's something that has to be behind that in terms of putting in policies and putting in things in place to continue protecting us, and also building that allyship across the nation.
But you know what, to your point, babe, when you pass a law or a bill, it can just sit there. So with our allies, you can support in making sure that it's enforced. You can use your voice to ensure that the work that we are all doing collectively is actually trickling down into the communities that need to know about and hear it. When you are sitting in office spaces, or you're sitting with your colleagues and you hear opportunities, you can pass along our information. That's also being a part of an ally. When we're not around and we don't know what's going on in those closed doors meetings, you can support and represent us, even if it makes you uncomfortable. Because questions may come up, well, why do we think that they should be funded this much? But if you know about it, who we are, if you have been on the ground with us, you can speak to that. But if you don't connect, or you're not engaged in that way, of course you can't speak to it. And therefore, we lose that opportunity in those closed door meetings, in those closed door rooms. And it's not to say that we're banging on the door begging to be in there, but the reality is they are funded for their diversity programs. We are the diversity. So I do believe the conversations happening around us, they should at least be able to have well-informed information when they are in those rooms, when we're not there.
So what I'm hearing, and I'm keeping an eye on the time, because as always, when you all get going, we could be here for several days, let alone several hours. But what I'm hearing coming through from the conversation from all of you is what feels like a need to redefine the terminology we were using around the support that you feel the community needs to move towards better sustained outcomes for the Black community, the Latinx community, for all communities that have been underserved and under-resourced. And that perhaps redefining what we see community as and who we include in it, as opposed to looking at the idea of allies. Because when you are a member of community, you regard all of these things as being part of what you do. That's part of your role as a member of the community, as opposed to someone who's kind of on the side watching and contributing at will. When you're a member of a community, it's just part of what you do to make life better. And so that's what I hear coming out of today's conversation, that is something that would support you and move your goals ahead in service of, everyone with food allergies. I'm looking at the clock. I am sad to bring this conversation to a close, but I also know that there will be many more. I want to thank all of the panelists today, Dr. Lakiea Wright-Bello, Javier, Evelyn, Silvera, Dina Hawthorne-Silvera, for their advocacy and commitment, and for also the inspiration that you provide this community with every day through your work on behalf of all people with food allergies. We need to give a very special thank you to Emily Brown and the incredible staff of Food Equality Initiative for their critically important work and for bringing us here together again. I want to thank everyone who watches this for joining us for the Health 1 year later, a conversation on race and food allergy. We look forward again, as I said, to bringing you more conversations as soon as we can. Until then, happy Juneteenth, everyone, and have a wonderful weekend.